Hi, this is Dr. Aashish Taneja. I am the director at Bone and Joint Clinic. I am a senior orthopedic surgeon and a joint replacement surgeon. Today, I want to talk to you about revision total knee replacement. Total knee replacement has become very common. A lot of patients are getting a total knee replacement done and enjoying their life after surgery. The numbers have increased exponentially. Secondary to that, the revisions have also increased. Revision knee replacement, what does that mean? Revision knee replacement means when we have to revise a total knee replacement, when we have to do this again. There are four main causes which can lead to revision of a total knee replacement. One can be infection. Infection of a knee replacement is not very common. It can happen in about 2-3% of the total number of cases. What happens? If infection happens, unfortunately, the patient will have lot of pain, lot of swelling, and patient को हमेशा पेन रहेगा, इवन रेस्ट पे भी पेन रहेगा, उनकी मूवमेंट्स में हमेशा पेन रहेगा, साथ में फीवर भी आ सकता है. If that has happened immediately after your first knee replacement, then it is better to see the doctor on an urgent basis. Why? Because in the first 4 weeks after the knee replacement, there is a good chance we can have just a simple surgery of washout and we can preserve the original knee replacement. Once the window of the first 4 to 6 weeks is gone, then it becomes difficult to preserve the original knee replacement. Then we'll have to do a big procedure which will be divided into 2 stages. The first stage will be to remove the original knee replacement. We have to take all these components and replace it with antibiotic spacers. Then we have to wait for 6 weeks for the infection to settle. During this 6 weeks, we'll give you antibiotics in the form of IV or oral antibiotics. Once the infection is totally settled, only then we can do a final revision total knee replacement, and that will be involving bigger components, bigger than the primary components. So if unfortunately you have any symptom of persistent pain, swelling, fever after a total knee replacement, please consult a specialist to make sure it is not an infection, because infection, if caught early, can be managed in a much simpler way. What is the second cause of revision? Second cause of revision will be fractures. There can be fractures around the knee replacement. A lot of patients are living a very long life, that is good for us, but because of their age, their bones tend to become weak, and if they have a fall and have a fracture around the knee replacement, that will cause loosening of the knee joint. In that case, we'll have to do another operation. In cases of fractures around the knee replacement, we can either fix it with a plate, or in case the original knee replacement have become loose, we'll have to revise the whole knee replacement. The third cause of revision total knee replacement is loosening. Loosening as in aseptic loosening, which means there is no infection. The knee replacement has loosened over time. It will normally happen after 15-20 years of your primary surgery. If you had surgery about 15-20 years back, you had a very good time with the primary knee replacement, and it starts loosening over time. It becomes loose over a period of years. You may have pain on the initial walk. The initial few steps of your walk may be painful, which may settle with time. So this is an important symptom that you should catch. Starter pain is a classical symptom of loosening. What happens in loosening is आपको शुरू के few steps में pain रहेगा, जो कि after some time ठीक हो जाएगा. So please इसको ignore नहीं कीजिएगा, क्योंकि that can be a very important indicator of loosening of the knee components. And अगर हम knee loosening को जल्दी कैच करेंगे तो surgery will be much simpler, because if the implant is loose, it causes damage to the underlying bone. धीरे धीरे आपकी वो bone खराब होती जाएगी, and we'll have very less bone to work with in the revision surgery. Now the fourth cause. Fourth cause is a rare cause. It is called malalignment. In very few cases, the implant might have been slightly malaligned. मतलब उसकी position is not optimum. In those cases, there can be persistent pain. If the pain is persistent and not tolerable by the patient, we sometimes have to revise that knee joint as well. So these are the four main causes of revision total knee replacement. So if you have any of these symptoms, it is advisable to see a specialist as early as possible, so that your diagnosis is made in time, and if at all you need a second surgery, it is not as extensive as it would be if it is delayed. Thank you very much.